Yeah, hi everyone. Welcome to my YouTube channel. My name is Dr.WAN, and I am today to discuss more of an academic issue here, not just the generic diabetic story, but let's move into something serious and also interesting. That's toxicology. To be more precise, it is amphetamine, which is a big issue here in the Western world. I don't know in Africa, but I felt as let me have a chat with you guys here. I'm pretty sure in bigger nightclubs like in Douala and Yaoundé, you will find this substance there. We call it ecstasy or molly. These are all things that the youth, they are victims. In North America, it's a big trouble. In Europe as well. So I will entitle this one Pharmacology and Toxicology of MDMA. So MDMA stands for 3,4 methyldioxymethamphetamine. Again, MDMA stands for 3,4-methylene-dioxymethamphetamine, commonly known as ecstasy or molly. It is a psychoactive drug with stimulants, empathogenic, and entactogenic properties. It has gained significant popularity in recreational settings and has also shown potential therapeutic applications. However, these drugs have such acute and chronic toxic effects. Neurotoxicity to the serotoninergic system in the brain can also lead to a permanent physical and mental problem. So remember those keywords I gave in the beginning: the empathogenic and tactogenic. So those are the two properties that makes ecstasy a big issue. And so I just decided to make this video for you to have an idea what is it. If you've not heard about it, rest assured that if you're coming to Europe or North America, you will get to know this substance. It's found typically in nightclubs. MDMA, a substitute amphetamine, acts as a monoamino releasing agent by entering the monoaminergic neurons through monoamino transporters. It exists a high affinity for dopamine and norepinephrine and serotonin transporters, with a preference for the latter due to the methylene dioxide substitution. Unlike regular neurotransmitter release, MDMA induced release involve inhibiting VMAT2 and activating TAAR1. Inside the neuron, MDMA's TAAR1 agonism leads to the phosphorylation of monoamino transporter by pKa and pKc. This phosphorylation either internalizes the transporter or reverses its flux direction. The inhibition of VMAT2 prevents the packaging of cytosolic monoamines into the synaptic vesicles, causing them to be pumped out of the neurons by the phosphorylated transporters. Consequently, neurotransmitters continuously leak into the synapse regardless of any signal received. MDMA consists of two enantiomers. You have the S-MDMA and the R-MDMA. The recreational forms of MDMA is an equimolar mixture of both. The entactogenic effects of MDMA are primarily attributed to S MDMA, which more efficiently releases serotonin, norepinephrine, and dopamine via monoamino transporter. Additionally, as MDMA exhibits a higher affinity for 5-HT2CR. On the other hand, our MDMA has notable agonism towards 5-HT2AR, which is believed to contribute to the mild psychedelic hallucinations induced by high doses of MDMA in humans. Now let's look at the pharmacokinetics of MDMA. MDMA follows a distinct pharmacokinetic profile. Upon ingestion, the concentration of MDMA in the bloodstream begins to rise around 30 minutes and reaches its peaks between 1.5 to 3 hours. Over the next several hours, MDMA and its metabolites are gradually metabolized and excreted, leading to a decrease in the levels by half. The duration of action typically spans 4 to 6 hours, during which serotonin's level in the brain become depleted. It takes approximately 24 to 48 hours for serotonin level to return to normal. The liver plays a significant role in metabolizing MDMA, with about 80% of the drug being metabolized in this organ. The remaining 20% is excreted unchanged in the urine. MDMA undergoes two primary metabolic pathways, and the first one is demethylation followed by methylation and or conjugation. And then you have now the N-dealkylation, deamination, and oxidation resulting in benzoic acid derivatives conjugated with glycine. Enzymes such as cytochrome P450, cytochrome P450 2D6, that's the subgroup, and the cytochrome P450 3A4, as well as catecho or methyltransferase COMT, are involved in the metabolism of MDMA. The pharmacokinetics of MDMA can be complex and nonlinear. Higher doses of MDMA may lead to sustained and elevated concentration of the drug due to oral inhibition of cytochrome P450 2D6 and cytochrome P450 2D8 enzymes, resulting in zero oral kinetics. MDMA and its metabolites are primarily excreted as conjugates such as sulfates and glucuronides. Although MDMA is usually administered as a racemate, the two enantiomers exhibit different kinetics. The S enantiomer has a shorter elimination half-life and greater excretion compared to the R enantiomer. Studies suggest that the R enantiomer has a higher area under the concentration time curve AUC and a longer plasma half-life than the S enantiomer. Effects of MDMA. The first one is recreational effects. MDMA is commonly used in recreational settings for its euphoric and empathogenic effect. Users often report increased sociability, emotional openness, heightened sensory perception, and enhanced feelings of connection with others. These effects are believed to result from the release of serotonin and modulation of various neurotransmitter systems. The second aspect here is therapeutic potential. MDMA has shown promise as an adjunct to psychotherapy, particularly in the treatment of post-traumatic stress disorder, PTSD. Clinical trials have demonstrated that MDMA-assisted therapy can facilitate emotional processing, reduce anxiety, and improve treatment outcomes of individuals with PTSD. It is thought that the drug enhances the therapeutic alliance and promotes a state of safety and trust during therapy sessions. Now let's look at the adverse effect. That's the other side of the method. Adverse effect of MDMA. We have adverse effect. While MDMA can produce pleasurable effect, it is not without risk. The drug can cause a range of short-term and long-term adverse effects. Short-term adverse effects we have such as MDMA includes increased heart rate, elevated blood pressure, dehydration, hyperthermia, jaw clenching, bruxism, that's teeth grinding. These physiological responses combined with vigorous physical activity often associated with MDMA use can lead to severe complications such as heat stroke and cardiovascular emergency. Long-term adverse effect. For long-term adverse effect, we have MDMA associated with cognitive impairment. Chronic user may experience difficulty with memory, attention, executive function. Prolonged MDMA use has also been linked to alteration in serotonin function. That is, here we are talking about down regulation, which we shall talk about that one further. I'm going to make another video to explain this in a better way. It's a whole topic on its own when it comes to receptors. Receptors undergo down regulation when they are put under pressure or stress. So prolonged MDMA use has also been linked to alterations in serotonin function, which can contribute to mood disorder and increase vulnerability to the psychiatric condition. Reinforcement disorder. Although MDMA does not typically produce severe physical dependence, psychological dependence and compulsive drug-seeking behavior can occur. Some individuals may develop a pattern of excessive MDMA use, leading to adverse consequences in various aspects of their lives. Another aspect is during pregnancy. The use of MDMA during pregnancy poses significant risk to both the mother and the developing fetus. Studies have shown that MDMA exposure during pregnancy can lead to developmental abnormalities and long-term neurobehavioral impairment in offspring. It is crucial to emphasize the importance of avoiding MDMA use during pregnancy to protect maternal and fetal health. The next aspect here is the major physical toxicity of MDMA. MDMA, when used recreationally, can lead to several major physical toxicity affecting various organ systems. These toxicities include hepatic, that's the liver, cardiovascular, that's the heart and blood vessels, cerebral, that's the brain, and hyperpyresic, that's overheating effect. Hepatic toxicity. Prolonged or excessive use of MDMA can lead to liver damage. This can manifest as hepatocellular injury, inflammation, and impairment of the liver function. Elevated level of enzymes such as the alanine aminotransferase, which is known as ALT, and the aspartate aminotransferase, which is known as AST, may indicate liver damage. In severe cases, acute liver failure can occur, although it is relatively rare. Cardiovascular toxicity. MDMA can exert significant effect on the cardiovascular system. It can increase heart rate, blood pressure, and cause vasoconstriction. This effect can put a strain on the heart and blood vessels, potentially leading to cardiovascular complications such as myocardial infarction, heart attack. Arrhythmias, that is abnormal heart rhythm, and hypertensive crisis. Cerebral toxicity. MDMA use has been associated with adverse effects on the brain. It can cause changes in neurotransmitter systems, including serotonin, dopamine, norepinephrine, which can disrupt normal brain function. Acute complications may include serotonin syndrome, a potentially life-threatening condition characterized by agitation, confusion, rapid heartbeat, high blood pressure, hyperthemia. In some cases, MDMA use has been linked to hemorrhagic stroke and cerebral edema. And the last one is hyperphagia. One of the most concerned acute toxicity associated with MDMA is hyperphagia, which refers to dangerously high body temperature. MDMA can disrupt the body's thermoregulation mechanism, leading to uncontrolled overheating. Hyperphagia can result in severe dehydration, multi-organ failure, rhabdomyolysis, that's muscle breakdown, and even death if not promptly addressed. So that's the message for you folks. You need to know this, because if you are coming to the Western world or you are going to nightclubs, I'm pretty sure nightclub down there should have these things there. So that's the message here. Know what you are doing. Those who love pharmacology, I'm going to produce another one of these, another interesting one, more intense, more therapeutic, and that's it. Once more, love this video, ask questions, share my YouTube channel with everyone. My name is Dr. WAN. Have a wonderful day. Ciao.